Well, as I say, the combination of any chemotherapy with bevacizumab is really well tolerated, and the side effects that we'll see have been principally limited to the side effects we experience with the chemotherapy. That is, bevacizumab really doesn't contribute to side effects. If a side effect occurs, it's going to be in the form of hypertension, which will arise a few months after starting it, and if that were the case, I wouldn't necessarily change the regimen, but I would certainly provide treatment, usually an ACE inhibitor for the hypertension, which usually is quite effective. We do check urine proteins periodically for patients on chemotherapy plus bevacizumab, and were there to be significant elevations in proteinuria, that might be a circumstance to discontinue or at least suspend the use of bevacizumab. But frankly, even there, that's so uncommon that I can't even remember the last time I had to do that. I'd say the only other consideration is that sometimes we're giving this regimen for patients who may ultimately go on to get surgery, like a resection of a liver metastasis or a lung metastasis, where potentially a curative surgical approach might follow, in part because the response to chemotherapy was so good. If that were to happen, the other important consideration is you will want to hold the bevacizumab at least 4 weeks prior to surgery, so that in those circumstances, you may say, well, the last dose of chemotherapy that you're going to receive before your surgery will be chemotherapy without bevacizumab in order to reduce any complication from surgery.